So first of all, it's absolutely fantastic to be here. And if you've got any questions at any point, please just put your hand up, shout out. I don't mind at all. Please just stop me. So I want to talk today about understanding and helping to reduce some of the behaviour problems that people with PWS or Prader-Willi syndrome can experience. So one of the really important behaviour difficulties that we know is particularly important for families from speaking to them is the frequent and often severe temper outbursts that individuals often show. So there's quite a few research studies now that suggest that at least 80% of individuals with PWS will show temper outbursts and have problems with temper outbursts at some point in their lives. Not necessarily throughout their lives, but at some point. So that we're on the same page when we're talking about a temper outburst, I want to start by showing you a video that shows some clips of a temper outburst as shown by a wonderful child actress who worked with us a while ago.
Sarah, I've got some news. You know that parcel of cases that you're supposed to be going to tomorrow? Yeah. Well, her mum's just called and said that her granny's really ill, so unfortunately you can't go to the party tomorrow. I'm really sorry.
I think it's up, Max. It's just this video. It's quite quiet. Sorry, the sound's quite quiet, but you'll see the behaviours in a minute.
You said I could go to the party. 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 I want to go to the party. I hate you. I never get to go anywhere. You never let me do anything. I'm sorry. I didn't mean it. I'm sorry.
Okay, so when we're thinking about the temper outbursts that individuals with PWS can show, it's important that we think about this in the context also of typical development. So we know that most children of around 1.5 to 2 years will show quite frequent temper outbursts. But typically, when children get to about 6 years, those temper outbursts become a lot less frequent. And what we think is going on there is that the parts of the brain that are really important for helping children to control their own emotions are developing very quickly at that time. And so that's why children show this blip where they're showing more temper outbursts, but that once they've developed that ability to control their own emotions, they then show far fewer temper outbursts. So then after 6 years, most typical children would show temper outbursts quite infrequently. The important thing, I guess, with PWS is that children can show more frequent and more severe temper outbursts, but importantly, those can go on further throughout childhood and often also into adulthood. So that makes us need to understand why individuals with PWS might show these particularly frequent, severe temper outbursts for more of their lives. So, one of the things that we did at the very beginning of our research into this, which is more than 10 years ago now, is to start to talk to families about when do temper outbursts happen. because that should help us to understand some of the factors that cause these temper outbursts, and if we identify what might be causing the temper outburst, then we can help to develop strategies to help families to deal better with them. So I'm going to give you two important examples. One example is where, for example, my child is used to going to school on the school bus, and it's normally Bill who drives the school bus. So every time Bill turns up to drive a school bus, I go to school as normal. That's part of my routine. But if one day Bill is ill and Bob, the bus driver, turns up instead, then my child shows a massive temper outburst and I can't get them on the school bus to go to school. Other important example would be my child's granny has got used to buying my child a packet of sugar-free sweets to give to my child for the car journey home after visiting her. So my child is used to always getting this packet of sugar-free sweets from her granny every time we go to visit. But then on one time, her granny forgets to buy the sweets, so doesn't have any sweets to give her. So my child's not getting the sweets that she expects. And then on the journey home, my child has a huge temper outburst and it's really difficult to get her home. So those are two really important kinds of examples, and they illustrate part of a wider problem that we've found many individuals with PWS experience. And that's a difficulty in dealing with changes to routines or in what we're expecting is going to happen. So from these interviews that we did, temper outbursts often follow when things have changed in our routine or in the expectation. And also, all of these sorts of changes invariably create quite a bit of upset and increase other behaviours that can be difficult to manage, like repetitive questions. So we know that this difficulty with change is part of a wider problem. But coming back to the temper outbursts, we know that temper outbursts often follow these changes. So that suggests that if the changes are playing an important role in the temper outbursts, if we can learn to deal with the changes, that should help us to better manage the temper outbursts. But that raises an important question, because in the two examples that I gave you, both of those examples were temper outbursts that followed a change to the child's routine or expectation. But sometimes other things are going on in individuals' lives, perhaps most of the time. So if you think back to the example with the sweets, yes, when my child doesn't get the packet of sweets that she's expecting, it is a change to her expectation. But it's also, there's something else important going on, because she probably wants to have that packet of sweets. She's probably really looking forward to it. So not getting the packet of sweets that she's looking forward to could also be a major disappointment, and that could also be feeding into the temper outburst. So if we want to think about developing a helping strategy that's targeting the difficulty with change, then we need to try to find out what the role of changes on their own is in individuals' behaviour. So we want to try to separate out and control everything else. I'm going to do a demonstration now about one of these strategies that we're trying to develop at the moment, and we've been working on quite a lot. So in this demonstration, I'm going to play some quite horrible, loud noises. So if you have sensitive hearing, just cover your ears. Okay, so was anyone expecting to hear the noise on that last time? Yes, some people are nodding. Good. So the point is that because the first 3 times you saw that yellow noise sign, I played you that loud, horrible noise, you should have learned that seeing that yellow noise sign means a noise is going to happen. So then, if when you saw the yellow noise sign the last time and I didn't play the noise, that should have made you feel a little bit surprised. But also, really importantly, I hope that some of you should have found that the 3rd time I played the noise, it wasn't quite so bad as the first time. Some people are nodding. Good. If I'd have done it for a long time, it would have had a better effect. But the point is then, because you know what to expect, and I've given you that warning, you have time to prepare for that horrible thing that's going to happen. So it's much more predictable for you, and you've got time to prepare for it. So that's basically how our change signalling strategy works. With the change signalling strategy, we have a brightly coloured, distinctive card that you can see on the slide there. So it's very visual, so that takes advantage of what we know are strengths in visual skills in individuals with Prader-Willi syndrome. And the key thing is that we teach parents and caregivers how to use the card to signal a change whenever they have prior warning that something is going to change. The key thing is that individuals with PWS should never experience seeing the card unless something then goes on to change. So that means that the link between seeing the card and something then changing in their routine or in their expectation is completely predictable. So even though they don't know what is going to change, they know that definitely something will always change. And so that should make the change itself more predictable. So we've trialled this strategy in a small group of children and some adults as well with PWS. So then to prove in sort of proof of concept that it can work, what we did was to observe individuals' routines in a similar way to as I showed you with the clips for Becky. But this time we deliberately chose routines or expectations that families told us would definitely cause some upset, but wouldn't cause sort of full temper outbursts, because we wanted to be able to observe it lots of times and we didn't want to cause a lot of disruption to people's lives. So the key thing is when we observe the routine or expectation being changed without the signal, then we still see temper outbursts and temper outburst behaviour. But if we look at that same routine with the signal, then there's a lot lower temper outburst behaviour. So we don't see anywhere near as much temper outburst behaviour. But that's with specific routines. So we've shown that our signal card can reduce the temper outburst that people show linked to a change in a particular routine or expectation. And now what we're doing is a much wider study evaluating this signalling strategy and another one which I'm going to mention in a minute. So in this strategy, we've got several families with individuals with children with PWS involved. We've also got some individuals with other developmental disorders that have difficulties with change involved. And we've developed web-based resources to teach caregivers how to use the signal card. And the key thing that we do there is to try to build up the teaching of the signal card to the child gradually. So we start by teaching children what the card means in a game-type context. So that means they're learning in a fun situation that when they see the card, something changes in the game. But caregivers can make sure that when they make those changes, they're quite positive changes. So children learn that the card is signalling a change, but it's not always a bad change. And then we ask caregivers to start using the signal card in everyday life, but not for any old change. Instead, just for what we're calling positive changes. So those are very small things that families can say, yes, actually that is a change, but because it's something that's so highly preferred, it probably wouldn't cause a problem. So, for example, several families have said, okay, something's going to change. You can have an extra 5 minutes of iPad time before bed. And because they know that their child really likes iPad time, even though it's a change, it's a positive change. And so families build this up really gradually. They start by using the card in these positive situations, and then very gradually they start introducing it for other changes in daily life, right the way up to then using it for all changes that they have the ability to predict, so that they have some warning of. So I'm just going to show you a clip from one of our training resources, which is just to help to illustrate how to use the card, so it's a little bit clearer.
Okay, thanks for letting me know, Jenny. Bye. Bye-bye. Sarah, I need to talk to you for a minute.
Okay.
Something's going to change.
Okay.
Remember you were going to Katie's birthday party tomorrow?
Yeah.
Well, her granny's sick, so they can't have the party tomorrow anymore.
So does that mean I'm not going to Katie's party tomorrow?
No, you're not going to the party, I'm afraid.
Oh, okay.
Okay, well, thank you for understanding. I'm really proud of you.
Okay, so that's the idea behind it. And in this wider study, what we're also doing is comparing this signalling strategy to another strategy. And we're calling this planning ahead, but basically it's using visual schedules, which I'm sure many of you already have experience with visual schedules. They're used quite commonly in many schools. Normally, the purpose of a visual schedule is to communicate what's going to happen to a child, because that communication and knowing how things are going to work is very important. But the key way that we wanted to use the visual schedules to help deal specifically with changes that might trigger temper outbursts is to encourage families to think about which sorts of routines and expectations often cause temper outbursts, and so then think specifically about planning those routines and to use some sort of schedule that works well with their child's strengths to communicate that routine to their child. But also, critically, we wanted to allow for the ability for things to still change, because obviously even if we plan something out, stuff might still change. So in the training, what we ask families to do is to observe how a particular plan has worked over a period of time of using it, and identify points in the plan where some things have still changed. So if families have identified the bus driver example that I gave you earlier as a common one that could precipitate temper outbursts, then we would ask parents to plan the morning that includes the going to school on the school bus, but instead of just having one bus to school option, there would be more than one bus to school option. So it might be, okay, bus to school with Bill, but if Bill is ill, then bus to school with Bob, and if Bob is ill, then bus to school with another driver who you may not have met before. And so by increasing those possibilities in the schedule, then that still allows for a number of scenarios to be predictable. So we're in the middle of comparing, well, we've sort of come to the end of comparing these two strategies. The reason we wanted to compare two is because we think they'll work in different ways. So the signalling should help children to better deal with changes if they experience the change. But the planning ahead should make sure that children actually experience fewer changes. So because we have different expectations about how they'll work, that allows us to control for what we expect to happen and for what participants expect to happen, because we know that all of our expectations can have an important influence on what we think we're seeing in terms of changes in children's behaviour. Yes, so those are what we're comparing at the moment. So I can't give you the actual results yet, but I can give you some in-progress comments. And I think this is important because it's starting to suggest to us that going forward with this, we'll need a slightly different approach. So the signal card is very good because it's efficient. You only need to have the card and that's all you need. But the problem is that it only works when you have some prior notice, because the caregiver needs to know, oh, right, something's going to change, so that they can give the signal to say that something is going to change. So if they don't have that prior warning, obviously it's not going to work. So that's an anticipated difficulty, but it still means that there's limitations in how far it can help. The planning ahead, on the other hand, it requires many more resources because you have to make the plans. And if you were doing this for every part of life, that would be quite demanding. And that's definitely what some of the families who've been involved with this have told us. But if we were to go forward by combining the two strategies so that into one single set of resources that families could use, then we would work out how to encourage schedules to be used for routines where things are most likely to change with absolutely no warning, so that those could be scheduled with the different options. And then for the rest of the time where you normally get warning, then to use the signal card. And so that's how we're thinking we'll probably need to progress, but we're waiting to get the final results of the comparison, because that should give us more information about how to better adapt the strategies to make them more suitable to fit into families' everyday lives. Okay, good, I'm on time. So, we're coming up to the break fairly soon. So, and after the break, what I want to go on to talk about is why individuals with PWS may experience all of these difficulties with change. Because if we can understand why individuals may be experiencing these difficulties with change, then that should open up another different potential route to helping strategies. But before I move on to that, I want to go back, take a step back to think about the emotional side of things. So in the beginning, when I talked about temper outbursts in typical children, I said that one of the important things we think are going on there is that typical 1 to 2 year olds aren't able to fully control their own emotions. So they have these temper outbursts that are really just outpourings of frustration, anger, all sorts of negative emotions that they can't control. So one possibility then is that individuals with PWS have difficulties in controlling their emotions. And so I want to just quickly mention some work that Professor Tony Holland and Dr. Katie Manning have been doing in Cambridge, because that's relevant to this emotion issue. So what they did in Cambridge was, in the team that Tony heads, there's another group of expertise on epilepsy, and that team had been using a device called a vagal nerve stimulator to help treat epilepsy in patients that have epilepsy. And they've noticed that a major side effect of that treatment was loss of appetite. So they got approval to implant these vagal nerve stimulator devices into 3 participants, adults with PWS, 2 women and 1 man. And they were hoping, because these individuals showed really quite a lot of health problems due to being overweight, they really wanted to reduce appetite and reduce eating. They didn't find any positive effects on the reductions in appetite. There was no effect on appetite at all. But what they did find was that the 2 individuals who had the device implanted that beforehand showed quite severe temper outbursts and quite frequent temper outbursts completely changed their behaviour and showed far fewer, if any, temper outbursts. So now what they're doing is a bigger study to look specifically at the effect of this vagal nerve stimulation on temper outbursts. And they're working with 6, again, adults. And because the technology has advanced now, the device can be worn outside the body, so you don't have to have it implanted. One of the key things that was a positive result from the people that stopped having temper outbursts is that the one young woman was actually able to get married while having the vagal nerve stimulation. And both her and her family said there's no way she could have even contemplated getting married before, just because her behaviour problems were so severe. And so both of those 2 individuals that have had seen the change with temper outbursts have requested to keep the device switched on. And the reason this is relevant to emotions is because this vagal nerve stimulator stimulates a nerve in the brain that basically dampens our physiological arousal. So, for example, it will reduce heart rate. So, in other words, it's like helping you to better physiologically control your emotions. And so that's really interesting because it suggests that perhaps one of the difficulties with individuals with PWS is that they have a physiological difficulty in controlling the physiological component of their emotion. And one reason this is really important is that if it's a problem with the physiological control of emotion, it would mean that there should be difficulties controlling negative emotions, but also positive emotions, because it's not the physiological part of the emotion that changes whether it's positive or negative. That's how you interpret it. And so this gives me an idea that I'd really like to pursue in future research that I just want to mention to you before the break so that you can think about it in the break and perhaps come and talk to me about after. So I was at a UK national Prader-Willi syndrome conference a few months ago, and there was a little girl with Prader-Willi syndrome who at the evening event had told her mum over and over again that she really wanted this sock that was a puppet, so like a sock puppet that was on display on the table. And the reason it was on display was because they had a raffle. And so her mum explained to her that she would be able to have the sock puppet if their number on the raffle was called. So when it got to the raffle, the little girl was actually on stage helping the commentator call out the numbers. And then she saw that her mum had her number called out and saw that her mum went to pick up the sock puppet. And she just let out a squeal of delight. and her little face was just overpouring with joy, like massive smile, tears in her eyes. Many people in the room, including me, had tears in their eyes just because she was just experiencing such joy. And that's consistent with then some reports that families have told us about observing these really heightened experiences of positive emotion in their children. And that makes me think, well, that's really exciting, because if individuals have a physiological problem with dealing with emotion, then they should be experiencing some highly negative emotion, but also some highly positive emotion. And there's already psychological methods that exist, so psychological techniques that help us to reinterpret how we're thinking about things and basically turn a negative emotion into a positive emotion. So if we could show that this is the case in people with Prader-Willi syndrome, then we might be able to develop those psychological techniques so that we could help individuals to change how they're thinking about a negative emotion, so that they go from having lots of experiences of really high negative emotion to then just actually having lots of experience of really high positive emotion. So that's an idea that really excites me for future research. I'd really like to find out much more about the experience of positive emotion to see if it is the case that individuals are experiencing heightened emotion of lots of different types, negative and positive. And if that's the case, then I'd really like to work out how to develop these psychological strategies in a way that individuals with PWS can use to turn their negative emotion into positive emotion.